As I told you before, the origin of the dental pain could be from the pulp, لذلك يسموه pulpal pain. And the pulpal pain اللي هو سبب acute pulpitis or chronic pulpitis or local hyperemia for the pulp. فبصورة عامة pain of the pulp may be sharp, throbbing or dull. It can be spontaneous, يعني يجي فجأة, or provoked or exacerbated by percussion, thermal or electrical stimulus. It is associated with a compromised dental pulp due to the deep caries, crown fracture, or recent dental work. يعني أنت من راح تاخذ history من المريض ممكن يكون عنده deep cavity أو يكون عنده حشوة new filling أو fracture of the crown. راح تعرف إنه سبب الألم هو dental. The treatment is by removal of the carious lesion, or endodontic treatment, or tooth restoration, or endodontic treatment if possible. And if there is no facilities, you might return back to the extraction of the tooth. Other source of the pain related to the dental tissue is the periodontal pain. For periodontal pain arising from the periodontal tissue, characterized by localization, deep and continuous, and associated with compromised periodontia, اللي هي الجنجيفال periodontal ligament والalveolar bone, and usually exacerbated by biting and chewing and percussion. واحنا طول اليوم ناكل ونمضغ، فدائما تشوفون الألم إذا عندكم periodontal condition تقريبا الألم يكون continuous. Usually here a sign of periodontal inflammation or abscess with or without tooth mobility، يعني تفحصون المريض يعني تلقون bad oral hygiene, gum retention, bone loss with or without mobility of the teeth، أو أحيانا تشوفون periodontal abscess associated with that tooth. فبالسهولة لطبيب الأسنان أن يشخص periodontal disease. You might need a periapical radiograph which may aid to the diagnosis, and especially the bite wing to see if there is a pocket or bone loss. Treatment option for periodontal disease: drainage and debridement of the periodontal pocket, scaling and rotoplaning, periodontal surgery for the elevation of the periodontal pocket, removal of the distracted bone, and sometimes endodontic treatment associated with the periodontal when there is a severe destruction of the periodontal tissue reaching the periapical area. And if there is no resolution for this condition, you might reach to the tooth extraction too. Another type of pain related to the dental tissue, although it is rare, but it's sometimes difficult to diagnose. يسموه cracked tooth pain، يعني tooth صار بيه cracking، وهذا الكراكينج قد يكون horizontal وقد يكون vertical. الهوريزونتال أحيانا very simple you have to diagnose it by movement of the mobility of the tooth or by radiographic examination. بس إذا واحد بيصير longitudinal cracking يصبح الdiagnosis difficult ويصبح الtooth origin for a pain which is difficult sometimes to diagnose such a pain. So a cracked tooth pain, it is associated with the fractured tooth with a history of trauma or restoration dental work. Restoration dental work يعني شنو؟ مثلا انت مشتغل على التوث مسوي له اندو ومدخل بيه بوست وصار بيه كراك، وهذا الكراك صار longitudinal مو horizontal. فانت كملت العلاج تشوف المريض ورا ما يدوس على سنه يوجع، لان من يدوس على السن when you press on the tooth التوث ينفتح يعني بيه cracking، فوين يسلط الضغط على النيبرنج تيشو فيحس بالألم أو يقول لك ما مرتاح من السن مالتي. The pain of a cracked tooth usually sharp, spontaneous, or provoked by biting and chewing or percussion. Fractured tooth can usually be detected by clinical examination or periapical examination, وهذا الخاصية الراديوغرافيك examination لازم الانتربريتيشن مالتكم يكون very good interpretation, very good radiograph, quality multi radiograph with good experience to have such a diagnosis. Treatment depend on the level of the tooth fracture. كل ما يكون الفراكتشر بالابيكال اريا قلنا تتذكرون بالصف الرابع قلنا نقدر نسوي بريابيكال سيرجري، بس اذا كان الفراكتشر قريب على الكورونا it is a hopeless, then restoration or extraction or other source of the orofacial pain related to the teeth called dentinal pain. Pain which origin with dentin origin يسموه dentinal pain. امتى نشوف هذا الألم؟ pain دائما يكون من الدنتانال، يكون brief, sometimes sharp, provoked by different kind of stimulus to the dentin, hot or cold application. يعني أحيانا المريض يقول لك أنا من آخذ حار بارد أسناني توجعني، تخلي ضمن الأشياء اللي بالديفرنشال دايجنوز مثلا أول واحد هو الكيريز، ثاني واحد هو الجم عفوا teeth attrition and exposed of the dentin or exposed of the cementum of the root or the dentin of the root. It is caused by stimulation exposed dentin or cementum that may result from recession of the periodontal tissue and possible erosion of the dentinal structure. Treatment for such condition may include mouthwashes اللي بيه فلورايد، أو يستخدمون desensitizing toothpaste، أو أحيانا نسوي restoration يعني خاصية منطقة cervical enamel junction pain يصبح عالي فنتخلص منه نسوي له filling. وأحيانا كلها ما تفيد نرجع نسوي endodontic filling for the removal of such a severe sensitivity of the teeth. Patient should be educated about the diet، يعني يحاول يتجنب الأشياء الباردة أو الحارة كلش. tooth brushing force لازم يستخدم soft or very soft toothbrush، ما يستخدم force عالية على التيت لأن هي تسوي لنا gum recession and exposed of the dentin. وعدد المرات اللي يفرج بها المريض، أكو ناس يقول لك أنا أفرج 4-5 مرات تشوفوه مسوي severe attrition، يتصور إنه كل ما يفرج أكثر كل ما يكون أحسن. Okay, tooth brushing regarding the force and the frequency and the proper tooth paste. البيست اللي ما بي structure يسوي لنا erosion for the root or the exposed dentin. Also for the intraoral origin of orofacial pain, the pain might be arising from the soft tissue يسموه oral mucous membrane disorder as a source of pain, which might refer to the orofacial region. So the disease of the oral mucosa are numerous and have a variety of local and systemic condition. وأعتقد هاي كلها درستوها انتو، كل الأورال manifestation مالت the systemic diseases or an intraoral causes. Pain may be a symptom of disease process، يعني مثلا ulceration due to the tumor مثلا disease process, secondary to associated process of infection in the oral cavity, related to the damage of the oral mucosa by trauma, chewing of the food, thermal or chemical stimulus أيضا يسوي لنا ulceration. Typically pain is associated with oral mucous lesion include ulcer، أكثر شيء ulceration، vesicles، هاي الفيزيكال أيضا يصير بها ulceration، physical and bully، erosion، erythema or red or white patches، كل هاي source of pain. Treatment and depend on the proper diagnosis، يعتمد التريتمنت على الدايجنوزيس، ممكن يكون systemic وممكن يكون local، and option may be include topical or systemic analgesic or corticosteroid according to the condition. So the oral mucous membrane is meant to be a source for the other source of orofacial pain, which have a near concern for the dentist, is the TM joint problem and its diseases. هذا الموضوع تتذكرون احنا أخذنا عنه محاضرتين شرحناه بالتفصيل من ناحية الاكزامينيشن ومن ناحية الديزيزز اللي تصير بالتي تمبرومانديبولار جوينت وسميناها تمبرومانديبولار جوينت ديس اوردرز. فممكن الديس اوردر يكون internal derangement تذكرون وهو الديسك displacement with or without reduction والincoordination of the movement of the condyle أو dislocation or subluxation of the TM joint with associated spasm of the muscle related to the TM joint as a source for pain. An inflammatory disorder مثل capsulitis or synovitis والأوستيوأرثرايتس والريماتويد أرثرايتس واحنا شرحناها بالتفصيل. كل هاي ممكن تكون source of pain, and your duty is a good diagnosis and good examination and good interpretation for TM joint disorder pain. The disorder of TM joint and its conditions, the pain associated with that structure mostly or usually localized to the periauricular area. يعني أحيانا تكون localized but أحيانا not localized. So localized to the periauricular area during the jaw function, opening and closing, and the presence of both painful clicking and crepitation. وعرفت ليش يصير clicking وليش يصير crepitation. The other sign is limited mouth opening. لما يكون mouth opening below the normal unit or normal value اللي هي 35 ملم normal opening 3 or 4 fingers. Deviated or painful jaw movement يعني أحيانا يصير نحرك الجو open and closed شو يصير ب deviation and painful movement during the opening and the closing. All these are sign and symptom of TM joint problem. There is a pain on palpation of the TM joint. إذا خليتوا يديكم على TM joint على منطقة الكوندايل or muscle related to the condyle or TM joint, the patient feel pain with possible swelling in acute phase, especially for the rheumatoid arthritis. CT scan, MRI may be needed to reach the diagnosis. يعني ويا الكلينيكال examination أحيانا تحتاجون radiographic examination, especially for the soft tissue of the TM joint, especially for the diagnosis of problem of. As you know from the previous lecture, how you can treat TM joint problem, or you have a good idea about this type of treatment. Treatment could be by patient education and self-care instruction. احنا شرحناها بالتفصيل. Medication اللي هي non-steroidal anti-inflammatory drugs or analgesic, non-opiate analgesic. Physical therapy through exercise program, occlusal supplement or surgery. Surgical intervention include erythrocentesis, arthroscopic examination or arthroscopic surgery, or the last sort is the open surgery. تتذكرون احنا قلنا التريتمنت بالتيم جوينت اكثر شيء conservative without surgery, special and a few cases اللي قدرناها بحدود 10. Within the method of the surgical procedure for the TM joint, closed surgery تتذكروها قلنا الاريثروسنتيسيس. وبالاريثروسنتيسيس هي معناته washing of the joint. تتذكرون هاي الصور شوفوا هنا inlet هنا outlet. حددون المكان اللي يدخلون به إلى الجوينت. So erythrocentesis is a conservative surgical intervention, closed method, not open method, that involve intra-articular lavage with or without deposition of hyaluronic acid, corticosteroid, وأحيانا تتذكرون قلنا normal saline, It is mainly indicated in the case of disc displacement without reduction. أحيانا يصير adhesion between the disc and the glenoid fossa, due to the rheumatoid or osteoarthritis destruction بالjoint يصير، فيستخدمون electrocentesis for lavaging or washing of the area. And many cases show an improvement for the removal of the pain and the time. The other method for closed surgical procedure for TM joint, also discussed before, is the use of arthroscope اللي يسموها الارثروسكوبي. وهاي الصورة تتذكرون أنا شفت لكم إياها مسبقا، وهذا الارثروسكوب يدخلون إلى الجوينت وبكاميرا يمكن يباوع على الجوينت مباشرة if there is an abnormality or adhesion in the disc and the glenoid fossa. So an arthroscopy, it is a closed surgical procedure that allows direct observation to the joint tissue, used for the treatment and for the examination of the TM joint. هاي نقطة مهمة جدا. Diagnosis and the treatment. It is performed mainly in the upper joint of upper joint space. تعرفون الجوينت في two space, upper and lower space. فأكثر شيء يستخدموه بالupper space. It utilized primarily for the lysis and lavage of the joint, but also for the ablation of the adhesion. أحيانا يسوي لنا adhesion between the disc and the articular surface of the glenoid fossa، فهذا يفتح لنا يسوي لنا ablation of the adhesion between these two structures, assisting in the improvement of the condition and improvement of the opening and the closing of the mouth, and for the relieving of the pain اللي قلنا هو المصدر مال الأوروفيشال pain أحيانا يكون من TM joint. For the last method for the treatment of the TM joint, and the rare method, is the open surgery. Open surgery for the TM joint, and this is a rare procedure, but sometimes it is indicated primarily. It is called arthrotomy. It's a procedure that modifies the joint anatomy، يعني يغير في طبيعة الجوينت، such as total or partial joint reconstruction or replacement. وهي كلش حديثة هاي الطريقة، يستخدمون يسوون replacement of the joint, which is required for patients who have advanced TM joint destruction إلى الجوينت، destruction إلى الكوندايل. دائما يبدلون الكوندايل ويبدلون الجلينويد فوسا that meet the surgical criteria. لما يعني عندهم advanced TM joint اكو كرايتيريا محددة الى هالسيرجري يستخدمون الاوبن سيرجري and has been a refractory to the other modality of the treatment. يعني المشكلة الموجودة بالتيم جوينت قاوم الطريقة الأخرى والconservative method for the treatment، لذلك يرجعون إلى الأوبن method of treatment. الأوبن surgery TM joint used in cases of neoplasia الأورام، bony or fibrous ankylosis, severe chronic arthritis, and severe chronic dislocation. هاي indication. Other source for the orofacial pain related to the orofacial area is the muscular pain, and especially the muscle of the mastication related to the jaws during the function or during the closing and opening of the mouth. That type of the pain characterized by dull aching pain exacerbated by jaw function, open and closing, or by palpation during examination, or the patient with his finger on the special area there is a pain. There is a tenderness during palpation of the masticatory muscle and the tendon. لذلك عرفت تتذكرون قلت لازم كلكم تعرفون muscle of the mastication، insertion of the muscle of the two sides. Possible limited range of movement، لما تشوفون اكو limited بالmovement of the jaw لازم تخلوه ضمن قاطع muscular or TM joint problem. Can be associated with a parafunctional habit like bruxism. هذول أهل bruxism يصير عندهم muscular pain يسموه myofascial pain إذا تتذكرون. Myofascial pain disorder tend to be seen in a muscle pain condition and more chronic in nature. يعني المريض يجي يقول لك أنا عندي ألم صار له سنتين 3 4. فهل chronicity أكثر شيء معناته عندهم myofascial pain. And there are a trigger or tender point in one or more of these groups. يعني إذا فحصت أو سويت palpation إلى هاي المصل مال mastication تلقيها tender، وأحيانا تلقي مكانات خاصة توجع يسموها tender point أو trigger point for this muscle. فأكثر شيء يصير هذول موجود عند المايوفاشيال pain اللي هو source of orofacial pain related to the jaw. And this pain can be radiated to a distant area, remote area, with the stimulation. So it is a source for orofacial. Treatment of TM joint problem or TM joint pain in general and the myofascial pain depend on some point and some options, and these include self-education and self-care. ما تتذكرون بالمحاضرات مال TM joint إنه تعلم المريض إنه هذا اللي يصير عندك هو مو organic disease، مو tumor. You have to assure the patient, and so patient education and self-care is very important. The use of medication analgesic اللي قلنا هي أكثر شيء non steroidal anti-inflammatory و non opiate analgesic، لأن الأوبيت يسوي لنا addiction. muscle relaxant sometimes used. Antidepressant like tricyclic antidepressant. Anxiolytic like Valium, anticonvulsant, botulinum toxin, injection, vabocolant spray، استخدام التبريد، كل هاي تساعدنا على relieving of the pain. الأذر way هو الفيزيكال ثيرابي اللي قلنا هو التنس transcutaneous electric nerve stimulation physiotherapy. Massage or exercise program assist you for the relieving of the spasm of the muscle, and in consequences we have an improvement in the relieving of the pain or improvement of the patient condition. Occlusal supplant أحيانا استخدم for the removal of the pain، وشرحنا الانديكيشن مالتها والأنواع مالتها. الأذر واي هو الكونجكتيف behavior والباي فيدباك mechanism relaxation and the coping skill، كل هاي تساعدنا على removal of the pain from the TM joint. وهنا أنا شارح لكم بعض التعاريف شنو معنات الكونجكتيف behavior، learning how to manage stress and anxiety. والcoping skill is the methods a person used to deal with stressful situation. This may help to a person to face a situation, take action and flexible for and persistent in solving problem. يعني تعرفون قلنا التيم جوينت فيها psychological problem، فيعني إذا واحد كلش تأثر عليه السايكولوجي فيأثر لنا أيضا على السبازم of the muscle، بعد ذلك initiating muscular spasm and muscular pain related to the TM joint and aggravating the condition. So this definition to explore the definition of these